Hey y'all, the question I got was, how often do you need to get a deep cleaning? Let's dig in. Y'all, my name is Stina. I'm a registered dental hygienist. I'm also a student nurse, and we are going to talk about how often you should get non-surgical periodontal therapy. The American Academy of Periodontology is our guiding light and savior for periodontal disease, okay? And so what they say is there is no fixed frequency to get what most patients know as a deep cleaning. It is going to be on an as-needed basis. This is completely individualized to the patient. I have been asked, should I go to a regular, hygienist at a general office, or should I go and seek out a periodontist? Excellent question. A lot of times your dental hygienist at your general office is going to be your first line of defense. We're going to do your periodontal assessment. We're going to do all the charting that we need to do. We will determine the state of health of your gums, and then we go from there. When we take a look at your radiographs, this is very important. Your dental x-rays will show us if you have localized or generalized bone loss around your teeth. If you have inflamed gums and you have the presence of bone loss, and we see pretty clear signs of active periodontitis, then this is an indication for us to go through with the diagnosing process with our doctor to stage and grade your disease. Now, if you have 4 millimeter, 5 millimeter, whatever type of pseudo pockets, because you have inflammation in your gums that is in the absence of bone loss, this is gingivitis. For that, we do what's called scaling in the presence of inflammation. And gingivitis is a form of periodontal disease. And it just so happens to be the only reversible periodontal disease, because if it progresses to periodontitis, that is no longer reversible. When you go into your office and you are told that you need non-surgical periodontal therapy and you say, no, my insurance only covers a regular cleaning and that is exactly what you're going to do for me. Let me tell you why. No, we're not. A healthy mouth prophylaxis does not address the disease. It does not address the deep pockets, and it does not address what we need to do in the presence of your disease. Legally, that is not okay. Legally, if we bill that with all of our assessment data that proves otherwise that you are not healthy, that is insurance fraud. In addition to that, it's downright unethical, and none of us is okay with that. Now, after you get your non-surgical periodontal therapy, there is generally going to be a follow-up appointment. If we're following a textbook, it's going to be something like a few weeks, maybe like 4 weeks to 6 weeks or 4 weeks to 8 weeks. Take that with a grain of salt, y'all. What we are dealing with in our industry is the fact that if I try to go and put you on my schedule for a few weeks after, that is very likely not going to be what happens. And honestly, if you've already been there for 2, maybe 3 appointments already, it's very difficult for me to get people into the office for a 4th appointment. That's just facts. So once you get your deep cleaning, you are going to go on periodontal maintenance, and you're going to come in about 3 to 4 months for a periodontal maintenance visit. At that time, I will reevaluate your tissues. I will do more probing. I am going to make sure that your disease appears to be stabilized, but this is not something that is solely my responsibility. You have to work at this at home too. If you fail to respond to the treatment that we have done, and if you just are consistently showing up with signs of active periodontitis, that is a clear indication to us that we need to get you referred out to a periodontist. They do things that we cannot do, and it's just the truth. I hope that this video was valuable for you. Please, if you ever have any questions, I love to answer them. Drop them in the comments. And if you have any additional questions about deep cleaning or gingivitis, I would love to talk more about that. Thanks, y'all. Be well.